Hello, my name is Jeff Wright, and today I'll be speaking about the barriers and challenges healthcare organizations face when attempting to implement electronic health records. There are three primary objectives that will be covered during this presentation. First, I will discuss the role that EHR plays in effective and efficient healthcare delivery. I will then identify the challenges to EHR implementation in regards to interoperability, usability, and health IT safety. And finally, I will discuss the drivers, policy, and technical components that facilitate EHR implementation as a means to enhance healthcare outcomes. First, let's define electronic health records and their proposed benefits. Electronic health records are real-time, longitudinal patient medical records that enable healthcare providers to document, monitor, and manage healthcare delivery. While this is the simplest definition of EHRs, more complex EHR systems now include evidence-based clinical decision tools. Clinical decision support programs facilitate healthcare providers in clinical decision making and can improve accuracy of medication dosage and decrease risk related to medication errors. In addition to improving accuracy and reducing medication administration risk, EHR systems can improve physician adherence to organizational guidelines and enhance the relationship between patients and healthcare professionals. When effectively implemented, EHR systems can improve the quality, efficiency, and effectiveness of healthcare delivery. Now that we have an adequate understanding of the role that EHRs play in promoting efficient and effective healthcare delivery, I will discuss common challenges to implementation noted within the industry. These challenges include barriers to interoperability, poor provider buy-in due to issues with usability, and finally, structural and process challenges associated with the safety of health IT. I will discuss each of these in more detail in the slides to follow. The first major barrier to successful EHR implementation includes challenges with developing and implementing interoperable systems. Creating systems which are heterogeneous and interoperable will facilitate improved coordination of care between healthcare providers and organizations. This is especially important in managing the complexities associated with chronic illness and delivering care to an aging population. In addition to implementing EHR systems that are heterogeneous and interoperable, a second challenge is developing EHRs that meet the needs of various scientific communities with different backgrounds, skills, and approaches. To be effective, EHR systems must not only improve communication between providers, but they must also enhance coordination of care across multiple disciplines. A final barrier to EHR interoperability includes challenges with design, performance, and efficiency. As mentioned, the advantage to EHR implementation is improved efficiency and effectiveness in delivery of care. For EHR implementation to be successful, its design must seek to enhance performance and efficiency with healthcare delivery. This includes integrating strategies that improve interoperability and communication within the larger healthcare delivery system. In addition to barriers of interoperability, to successfully implement EHR, healthcare organizations must also develop strategies to meet barriers associated with usability of the system. For organizational success with EHR implementation, there must be buy-in from healthcare providers and acceptance of organizational guidelines. The success of EHR implementation is predicated on easy access and appropriate use of the EHR system by healthcare providers. Additionally, to mediate barriers with usability, healthcare organizations must be willing to develop systems that are adaptable to the needs of their providers, as well as remain committed to allocating necessary resources to grow, manage, and adapt these systems. This is especially important given the previously mentioned barriers to interoperability and EHR implementation among multiple disciplines. A final challenge to usability that must be mediated to facilitate effective implementation is development of EHR systems that address the organizational, social, and societal barriers with technology use in the healthcare system. While health information technology can facilitate enhanced quality, effectiveness, and efficiency in delivery of care, organizational, social, and societal barriers to technology use still exist within the industry. Educating providers of the benefits and use of EHR can help to mediate organizational barriers. Additionally, providing competency training in social and societal barriers can help to improve stigmas associated with technological advancement. As mentioned, effective EHR implementation can improve patient-provider relationship, but healthcare organizations must first ensure adequate training and education is provided to mediate these potential organizational, social, and societal barriers. A final challenge to successful EHR implementation are barriers associated with health IT safety. For organizational success, it is imperative that EHR systems are developed to improve interoperability and usability while also limiting adverse consequences associated with its use. This can include over-reliance on the EHR system and even unintended adverse consequences that undermine quality of care and increase risk to patient safety. Developing systems that are adaptable and allocating necessary resources to mediate these unintended consequences must be a priority for healthcare organizations. Additionally, healthcare organizations must also invest in resources to manage barriers to health IT security and safety. Developing infrastructure to protect patient health information, adapting organizational policies to prevent internal and external data breaches, and utilizing clinical decision support tools are some examples to help mediate these barriers. Finally, in addition to developing data protection policies, healthcare organizations must also integrate data governance practices and educate its healthcare providers on the expectations of utilizing the EHR system. Making health IT safety a priority will not only improve risk management, but it will also facilitate enhanced patient safety and coordination of care while utilizing the EHR system. Now that we've identified the benefits of EHR and addressed the barriers to successful implementation, it's also important to note the drivers, policy, and technical components which facilitate EHR integration. Since the 1990s, federal initiatives directed at developing alternative payment models have been a driving source for EHR implementation. As mentioned, research demonstrates that effective EHR implementation can improve quality, efficiency, and effectiveness of healthcare delivery. As alternative payment models continue to develop and ties to reimbursement are initiated, it will become crucial for healthcare organizations to develop and implement effective EHR systems to maintain compliance. Additionally, as healthcare reform continues to be shaped and molded, added pressure will be placed on healthcare organizations to meet quality, access, and affordability standards. These federal policy changes will continue to facilitate the transition to developing effective EHR systems. Finally, over the last decade, the healthcare industry has seen growth in the use of wearable technology and cloud-based applications. These, as well as other technological advancements, are likely to continue to improve coordination of care when integrated into the EHR system. To remain competitive, it will be imperative that healthcare organizations develop, integrate, and manage adaptable EHR systems that build on the advancements of these technologies. Successful integration of EHR can equip providers with the tools to better document, monitor, and manage healthcare delivery. Enhanced healthcare quality, effectiveness, and efficiency in delivery of care are some of the advantages to EHR implementation. The major challenges to implementation include barriers to interoperability, usability, and health IT safety. Healthcare organizations that can effectively mediate these barriers will not only improve the success of EHR implementation, but also become more equipped to manage the risk associated with unintended medical errors in the delivery of care. While transition towards alternative payment models has been a driver of EHR implementation since the 1990s, healthcare reform and advancements in health technology will continue to facilitate EHR integration. As alternative reimbursement models, federal policy, and technological advancements continue to drive EHR expansion, it will be imperative healthcare organizations develop strategies to mediate barriers associated with EHR integration. This will not only improve the financial solvency of the organization, but also enhance the quality, effectiveness, and efficiency of healthcare delivery for the patients it serves. I want to thank you for taking the time to listen to this presentation on the barriers and challenges to electronic health record implementation. This is a list of the references included within the presentation. Please feel free to ask a question, comment, or provide any feedback. Thanks.